I was a physiotherapist. I grew up in Australia doing my undergraduate in physiotherapy, came over here, worked in the NHS, and then got into elite sport. I played rugby to a fairly high level, so I was in that environment. I worked with professional rugby, professional cricket. In that time, very demanding, 24/7, almost like a concierge physio for all the elite athletes. So pretty much burnt me out. Best job in terms of fun, hardest job in terms of being 24/7 pretty much for a whole year. It's now come out that you know, bricks and mortar and digital should coexist. That pathway should be seamless. Everybody wants growth, but if you haven't got good product market fit, it ain't going to work. Even if you've got a great product and great product market fit, there might be a 12-month, 24-month lead time, until you find that place. But once you're in, it's sticky and it's good revenue. I do think there's a thing called the therapeutic alliance, whether that's psychological or physical from an MSK or a mental health point of view. And that is a very personalized relationship between practitioner and patient. And I can't see how that will change.
But if you get it wrong 20% of the time, and that 20% creates 200% new work, Hey everyone, we're back with Business of a Clinic. This time we're joined by Tim, who's going to be sharing his experience in the treatment room, out of the treatment room, working with health tech innovators, long-standing players, probably one of the few people who has seen the healthcare ecosystem from every imaginable perspective. So this will be a really interesting one to listen for. Tim, do you want to start out with a quick introduction? Tell us who you are.
Thanks, Jared, for having us. My name's Tim Wright. It's hard to put a label on me because, as I said, I do a lot of things, but CEO and founder of Zoes. But my background is actually, I was a physiotherapist. I mean, I technically am still, but I grew up in Australia doing my undergraduate in physiotherapy and came over here, worked in the NHS, and then got into elite sport. I played rugby to a fairly high level, so I was in that environment. But I worked with professional rugby, professional cricket, and then pretty much ended up in cricket, working for if you know, cricket county team and a bit of junior England, and working with a county down on the south coast with Sussex County Cricket Club. In that time, very demanding, 24/7, almost like a concierge physio for all the elite athletes, including overseas pros. And actually that overseas pro pretty much burnt me out. Best job in terms of fun, hardest job in terms of being 24/7 pretty much for a whole year. But then stepped away from that and got an opportunity to set up a on-site physio clinic within Deutsche Bank in the city. And then we grew a lovely business doing sort of first mover physios within investment banks, BNP Paribas, Deutsche, Morgan Stanley, etc. And then quite quickly, actually, after 3 years, we got acquired by what became the Nuffield story, or the Nuffield business. And I was involved in then rolling out more on-site physio delivery, other services, and then physio networks, nationwide network, which was actually the embryonic thinking of digital health. Because how do you scale bricks and mortar? Well, digital health is where it's at. And that's kind of the evolution. Has worked with digital health providers in a health tech, digital health, med tech, and now clinic tech space, which we're seeing phenomenal rise with. And I've worked with more than 50 plus companies in that space. And it's we see all sorts of different things, but in the clinic space, a lot of stuff going on, from the amazing work that you guys are doing to other stuff with scribing to kiosk, front desk with kiosk, etc. So looking at all those sort of different getting the edge in every part of that customer journey as such.
So I think, obviously, I have a better than zero understanding of what it means to work with Zoes today.
Yeah.
So just for folks who may be a little less familiar, how do people work with you, or how do you work with them? So when people come, you said med tech, clinic tech, all kinds of stuff. So you meet that, just talk us through.
So I didn't really expand enough, but in essence, we're an outsourced commercial consultancy business for companies that are operating in that space. So we're very good. We've got, we work fractionally. So we build fractional teams for the right verticals, especially in private healthcare, whether it's private hospital or private clinics or dental clinics or MSK clinics or insurers. We have a team of about 20 consultants who are specialists in different areas. And then we build teams specifically for that company to deliver results. Now, that could be revenue, it could be meetings, it could be proof of concept pilots, or it might be feasibility, go-to-market strategies. So we cover that sort of spectrum, but we're very goal specific to achieve those goals for our clients.
Fine. Okay. So if I'm a health tech business or innovation attempting to work in healthcare and I want to meet the right people, connect with the right partners, leverage the industry connectors, we come to Zoes. Zoes says, okay, here's how we push on the right doors. Here's how we bring the right people into conversation. That's sort of
we're all a bit older and wiser, I guess, in the team.
Definitely older.
Forget wise, but we all come with big networks. We've got the ex-sales director of AXA, for example. We've got the chair of the EAP Association. We get people who have worked in probably a very high level commercial role, BD commercial role, commercial director, who now wants to work fractionally. One wants to fly a pilot plane as well as still deliver fractional work. Another one has a farm. So, we cater to that. Actually, it works really well. And we're about fast access, fast results.
Got it. Interesting. And I can totally see how, someone's done 20, 25 years moving up the ranks in industry and then says, you know what, I've got deep know-how, but I want to do 50% of my day here, planting my crops, and I want to do 50% of my time speaking to new businesses that are trying to support health. This is the nexus. Zoes is the sort of nexus of these things.
Yeah.
Okay, got it. Makes sense. So you see a lot of different stuff.
Yeah, we see, we work mainly with homegrown British tech, but we do get overseas. We're getting a lot of European tech from Sweden, Denmark, Belgium. So a lot of European tech that wants to come into the UK, private or NHS. And then we're also taking some solutions out to also, you hear my twang, so to the Australian New Zealand market is another market.
Exporting, from here. That'd be interesting. And if you had to, let's just imagine for a minute that we're designing a menu, and the menu has a few different kinds of dishes, and each dish is a specific kind of innovation that you see. You sort of gave us some of those buckets already, but what's on that menu right now that you're seeing in market? Like, where are people? What pressure points are people pushing on? What are you seeing as really interesting?
Yeah. Okay. So in the clinic space, in the digital health space, or healthcare space as such. Wow, the GLP-1 space exploding. Okay. You know yourself, and whether that's fulfillment and logistic warehouses, which you think is just a warehouse, but it's not much more than that. Is very, very detailed. We're through to these big direct-to-consumer GLP-1 providers who are now starting to, they've exploded, but are they ready for the B2B market? Are insurers ready? Are cash plans? Are clinical providers, sort of hospital groups, are they ready for GLP-1s? There's a bit of a question mark, but it's much more towards accepting that now. So I think you're going to see a lot more and that brings clinical rigor. So a lot of wraparound, multidisciplinary teams around that, and clinical governance, etc., because the B2B won't go just for a direct-to-consumer post, especially not insurers. So that's one area of growth. ADHD and neurodiversity, another big area. We see they're probably the two big areas, as well as mental health, physio, the traditional areas as well. There's also the link between the digital front end and clinical, so more of a hybrid approach. We've seen the growth of that, not just relying on digital, perhaps that was in during COVID and the pandemic. It's now come out that bricks and mortar and digital should coexist. That pathway should be seamless. And then in the clinic and hospital space, it's really looking for operational efficiencies. The area you're in, leaky revenue, where's that patient journey from pre-assessment to the reception, through the journey, looking for where are the gaps, where are we scribing, for example, can we make operational efficiencies to increase the profitability and make it a much better experience for the client? And then from clinic owners, like what Coherent does really well is, what's not working, the patient engagement, the recall, the leaky revenue is a big area as well.
Got it. Okay, so really a mix. There's a huge one. And you mentioned earlier as well, in some cases, there was a med tech, like you see some med tech stuff as well. So I guess you're doing direct clinical impact stuff in some cases, and then in other cases, it's infrastructure, it's logistics, it's operations. You guys are seeing a lot of.
Yeah.
Interesting. So one of the things that I think would be really interesting to understand is when you see a new thing, or I mean, I imagine that 80% of your job is probably saying no to stuff.
Bang on.
Otherwise, it was like, you can't be able to do your job. So when you see a new thing, how do you as a team, like what's your sort of screening process? You're saying, okay, I think
we've become really good at that. I think we do get a lot of inbounds. I would say we get, 2, 3, 4 inbounds, not just from our website, but from many people who know people. And I think we're very good at understanding at what stage they're at, where they should be playing, or do they have the market knowledge? So quite often and also, are they, what sort of funding are they going to need for success? How are they going to build? Because everybody wants growth, but if you haven't got good product market fits, it ain't going to work. So we're very good at sort of that understanding. We call it 3 buckets: feasibility, or go to market, or feasibility analysis, which we think is kind of very much understanding where success is going to come from. So, for example, we're doing a piece with a GLP-1 provider. Is the B2B market ready? So they want to know the fitness vertical. They want to know the insurance landscape. They want to know the broker and corporate landscape. So we're able to sort of go to buyers, to influencers, to owners, to proposition leads, and get that intel. That was really crucial to be able to define what's going to work or what's not going to work, what's vertical prioritization. And then, commercial model as well. And understand what is needed for the next stage, which we call readiness, market readiness. Market readiness is very much about getting your house in order, regulatory, marketing, proof of concepts, because these B2B buyers are not just going to say yes. They want to see evidence, and you need to get evidence somehow. So pilots, proof of concepts, etc. And then, and then growth. It's not always a 1 bucket to 1 bucket ratio, but we find that they fit somewhere into that, or they don't. And so we're very good at exactly what you said, saying no, because we see a lot of wasted money out there. And you want to give the honest advice through experience to them to make the right decisions.
Makes sense. And you said, which I thought was very interesting, you said the B2B buyer. So in this case, that's in some cases, the healthcare provider, or it's the organization that's ultimately consuming whatever the thing is. I think it's interesting. One of the things that we often hear about and talk about from a, I guess, more tech than health tech perspective, but from a tech perspective is there are a lot of companies that have died on the hill of go-to-market in healthcare because it is really hard. The trust and barriers to adoption are much higher. The expectations of product performance are much higher. The risk when it goes wrong is much higher. There are a lot of reasons that getting over that trust hump in healthcare is fundamentally different than getting over the trust hump in e-commerce, shoes, pick your example. So I guess I'm sort of curious, in your experience working to not necessarily sell, I guess you don't really do a lot of selling on behalf of the companies you work with, but you do a lot of facilitating and trying to connect the dots. What do you see the buyer or the buy side, a hospital director, a clinic group, whatever buyer is, what are the blockers there? What are the challenges that you think, innovators and or people, sort of try to work with the providers need to overcome in order to be credible and attractive from a buyer perspective?
Yeah, are they, I'll just talk one insurers, it's credibility, it's impact, it's clinical governance, it's reputation, and then you're in a, if you've ticked all those boxes, then it's a procurement exercise as well. So, the sales cycle is incredibly long. Even if you've got a great product and great product market fit, it might be a 12-month, 24-month lead time, until you find that place. But once you're in, it's sticky and it's good revenue. So, it's worth the, but you've got to have the patience and you've got to tick all the boxes to what that vertical requires. And I think there is a lot of scrutiny. There is a lot of, the sales cycles are long. And it does make it challenging for tech or health tech providers to get into the market. So they've got to also pick the right investors to understand that as well. So impact investors or investors that understand the
healthcare space,
particularly.
Interesting. You gave earlier on, you mentioned one of the sort of categories of work, and you tacked onto it the fact that this was sort of a newer space by comparison. You used the title clinic tech. And I've heard you say that a few times now outside of this conversation. I've not heard it anywhere else, which either means you're brilliant or a terrible loss. What did I do?
I like that.
But it's an interesting category term because, there is med tech. There, you hear that word, you hear health tech, you hear digital health. And now there's this new sort of framing. I think you should own this space. Like there's clinic tech.
Yeah. I'm going to go and show on trademark.
So what is, when you're thinking, okay, this is what fits into the clinic tech box.
Yeah.
What lives in there?
Yeah, it's a really good point. I mean, I've just phrased it because when I think clinics, I'm thinking MSK clinics. I'm thinking dental clinics. I'm thinking vet clinics. I'm thinking, and yes, clinics that have probably 2 or 3 enterprise level and then up.
Yeah.
And so that's where I've sort of cut my, teeth before when I was a physio as well. And I've just seen an incredible amount. And I have to reflect back to when I was a clinician and building my business. It was like paper notes and, it was, people would miss appointments, and it was about the patient management software that was okay, but it didn't really fit for purpose. And then when I look back, it was like,
how do we ever do that?
How do we do that? Yeah, we must have missed so much revenue, so many patients. And so anyway, and to what I've seen now in the last sort of 12 months in particular is just so many efficiencies in that pathway of if I'm not a clinic owner, but if I was a clinic owner, I'd be all over this. Do you know what I mean? I'd be wanting to know how I can firstly give the best possible service to all my clients, and also as an owner be judicious in terms of making sure that I'm running the business as operationally well as possible. And obviously a lot of these multi-chain physio, psych, the primary GPs, dental or whatever, there's a lot of PE funding and look, they talk numbers, don't they? You know it better than me, probably, Jared, but they are all about sort of the margin, the profit, EBITDA and profitability. And so therefore, where are you going to find that? You're going to find that in that journey, from admin, from all those elements of that journey. And a patient management software doesn't do that. And so therefore you need to have solutions that are going to be integral to either integrate with that or to have a role to play with managing that or understanding that. And I'm sure a lot of clinic owners don't fully understand all the functionality of what their PMS systems are, etc. But I just think it's a fascinating area, and I've just seen a massive explosion. Obviously, the explosion of AI, etc., has changed the dynamics as well. But there's some really smart operators out there doing some great things.
So it's interesting. I think the thing that makes that story different to what we might hear from others is that you've lived firsthand, I guess in some ways, through an era of care provision where it was tech second. And now you're saying, well, there seems like there's this moment in time where actually it can be tech first.
Yeah.
And many providers are still not operating that way.
Yeah.
And the thing that we always find interesting when we start working with a practice is we just try and understand what they understand about what is going on in their own house. So one of the questions that we always ask is, how many patients are in your database? Which seems like a very silly question.
Mm-hmm.
And 9 times out of 10, I think it's 10,431. It's like, oh, is that real? Is that not real?
Yeah.
And other times we will hear things from patients, from practices, healthcare providers saying that we'll ask them, how many patients or how many appointments last month canceled their appointment?
Yeah.
Everybody looks at each other. Practice manager looks at the principal clinician. Principal clinician looks at the other, and the data is, of course, there.
Yeah.
No one's doing anything with it. And the question is why. And I think for me, also previously being in clinic, I think it's very hard for people to understand how intense it is to work in clinic.
Yeah.
It is always on, it's like working in a kitchen. It is just full on. The idea that you'd be able to stop, take a step back, look at things, try and take stock. I never found the time to do it. So I guess I'm sort of wondering, when you intersect your experience of being a practitioner at one point in time, and now sort of seeing the digital transformation as possible, what's blocking people from making that?
Kristen, I think one of the ones is certainly I'm going to put the physiotherapy world into here because, I was a physiotherapist that by default had a business.
Mm-hmm.
And I think that happens quite a bit. Physiotherapists suddenly have businesses and, some do have training. I did an MBA, but I'm sure others do some business, but they're suddenly running a business. And that's not really what they were trained to do. So sometimes they've just been thrown in the deep end in terms of, or learning through experience how this goes and how to run a business. And then their individual therapists that work there, they just want to treat. They hate doing notes. They just want to be client facing, doing a great job, improving the client, having a great rapport. And look, if they can just do that and walk away, amazing. And tech can do that now. So I think one of the things is they're not really trained to do it. All this tech is coming to them. They don't know what to do with it. They're not really data, they haven't learned how to deal with or understand MI or data. And so therefore there's a bit of a disconnect there. I think, learning more about dentals and vets a bit stronger because PE funding has probably helped them understand that. But yeah, physios are sometimes finding their way because they've just been thrown in the deep end in terms of, and you're just learning through experience.
Yeah, I don't know if it's just, I think it makes a lot of sense. I don't know if it's just physio. I mean, we were speaking a couple of days ago with two oculoplastic surgeons who came from X number of years in NHS. And it was actually very funny. They were saying when they started their private practice, they oftentimes just didn't charge people. And they said it was just such a change for them to go from not ever thinking about billing someone to realizing that if you don't bill someone, you don't get paid. Like that's the end of it. Yeah. And so they used to feel bad about billing people. And then they said, well, actually, we realized that when we billed them, A, correctly, and B, what we actually felt our time and value was worth, we were actually able to deliver a better experience to the patient because we weren't scraping by and constantly trying to cut corners and make things short. So I think that idea of like going on that learning curve, that journey makes a lot of sense. Speaking also with the MSK clinic owner recently based out in Canada, and his story was very similar, which is that they started the practice and it was just him and three other practitioners, and they sort of hit a plateau where they needed to get a different kind of unlock that wasn't natural to them. So they started working with a business coach. Things ended up going really well, but it's a journey. I mean, I think it is definitely a journey. So you sort of,
and it doesn't just stop at clinics. I've worked with some of the big hospital groups as well, private hospital groups. They're a mess as well.
You name names. Give us names.
No, I can't. I'll get in trouble. But I know that their systems are a mess.
They know it.
And this is it's the same in clinic as in hospital. It's just multiplied here. So they're scrambling around to patch systems to exit, but that customer journey is still a bit of, so there's a lot of that work going on at a hospital level as well. So we're not just talking about, small or even big chains, but talking about right up the chain.
Yeah. Is it true? We spoke to a transatlantic hospital group.
Yeah.
Something with lots of zeros in their revenue.
Right.
Following your introduction. And it was very interesting because we sat down with the something innovation, whatever it was. And we asked them a few questions and very quickly said, listen, I know the problem you guys are trying to solve. We have the problem. We know we have the problem. We are very clear on the fact that the problem exists. We are not currently prioritizing solving it because we're trying to prioritize solve all these other problems. And I think it's true of the fact that patient operations is a mess. it just is a mess. There's no two ways about it. It's not a linear journey. We always say it looks like a bowl of spaghetti. It's not, A to B. And what we constantly find in our work is that the ideal is that you scale your patients, not your operations, but oftentimes that doesn't happen. You end up scaling your patients and you end up scaling your operations with it. And so the cost and the revenue track together. And actually what should happen is it should do a bit more of that. And it's very hard to get that to pull down. The way you solve the problem is you just throw bodies at it. More headcount, more headcount. We got more patients, more headcount. Keep throwing headcount at it. So I think it's interesting that what you see is that actually that is true of, 2 practitioner, single site, 2 country, multi-site. The problems just get worse.
Yeah, the numbers get bigger.
And the numbers which is very interesting. If you had to, so now you know about go-to-market, the healthcare space, private health more generally, you've been a practitioner, you've set up your own practice. If you were restarting a clinic, I'm not saying you should do, but if you were restarting today,
Never know.
now here's the interesting part. So if you were restarting today and you said, okay, I'm going to open my next, done with Zoes, my next venture is...
just Zoes clinics.
There's Zoes clinics is X. This is how I do it differently now, knowing what I know, seeing the different parts of the ecosystem, et cetera, et cetera. What would you do differently? How would you think about it differently?
Oh, wow. That's a really good question. I would adapt a lot of these things. So I'd be all over the digitization. I'd have no reception. I mean, I love reception. I'm not trying to get rid of reception. Rewind time. But I'd make it a clinic which was complete. I'd be looking at every area of the pathway and how I can digitize that to make the experience in the treatment room exceptional. That's probably the way that I would look at it. And then I would try to scale that with the best cultured physios who love the profession and love getting results, but they don't really have to do the admin themselves. The tech can do the admin for them. And then obviously I want to make it as profitable as I can. So I'd be looking at everything. I'd bring you guys in for sure. I'd want to know, is it recall, DNAs, leaky revenue. I'd want to know all the information in a MI dashboard and where we can be as efficient and as effective as possible. Yeah. That would be the business I would try to build.
That's not the business you built when you opened it.
Well, I think we did have the essence of great physios. I think we had the essence of a great culture. We were working within corporate, so it was a bit different situation than having your own clinic. But we were hopeless at admin. So I wonder how much revenue we were letting go. But anyway, we had a successful exit and all that sort of thing. So I think the mantra, but I know as a physio, I love treating, but I hated the admin side of it. So if that was lifted and shifted and away, and, it was just a wonderful experience and a wonderful facility for the clients coming in. Happy physios, happy clients equals success. Yeah.
It's interesting. I went recently, a couple of months ago, I went to the Neco body scan, full body.
Yeah, I heard them speak it the other day. Yeah.
Sort of imaging.
300 quid, was it? 300?
As in 250. Early bird spare. I don't know what it was, whatever it was. But
waiting list of what, 12 months or something?
Something like that. And we want to talk about the experience, but it is very clear that they are very experience-centric. It's very clear that they are recruiting a type of practitioner or physician assistant, whoever's there, who really gets the brand. Everything from the way they're dressed to the way that they talk to their presentation, it joins up sort of end to end.
Yeah.
And there is a sense of being relaxed when you're there, which is very different than the sense of, being in many other provider, settings where you don't necessarily walk in and feel, that's...
Well, yeah, I think that's so key. That I like that because, when I used to business, we used to work in the city and on site. So these clients patients would come down frazzled of stress. So we wanted to make it as calm and as easy for them. And that's important in healthcare because, you're coming into an area that you want to, get rehabbed or have recovery or get pain relief. And so therefore you want to chill, you want to decompress while you're there as well.
And,
I love
and
that.
it's interesting. I think too often from a commercial perspective, too often, and we talk a lot about it here, there is this obsession about the time spent in the treatment room. And then as soon as you step out of the treatment room, the obsession starts to pull back. So if you spend 10 minutes a day thinking about what happens in the treatment room, you spend 7 minutes a day thinking about what happens in the waiting room, you spend 3 minutes a day thinking about what happens 2 days after the appointment, you spend no time thinking about what happens 6 months after that. It sort of degrades.
Yeah.
And much like a restaurant, people go back because the food's good and because the service and the experience are great. And people are excited about going back for those reasons. And what I think you're describing is we want end to end it to be a place that has almost like a magnetic quality.
Yeah.
It should be easy to come back, not, this thing again.
And that's as much as, talking about that transatlantic hospital group, I had every year I invest in it, like you did with Neko, a health assessment. And I got a full man health assessment, etc. In the clinic, brilliant. Outside of it, horrendous, from my results, from the pre-assessment, from turning up and paying. And that really spoilt the whole experience, that even though the experience in the clinic was great and the doctor was brilliant and I had a great rapport with the doctor, and actually I thought, and it was a lovely experience, but the other stuff really soured me.
Break down.
Enough to say, I don't think I'll do that again. Yeah. So that other stuff is important.
It is super important, and more so today, because I think people, even as a patient or a consumer of things, like push button, give me the thing. I push the button, I get my imported specialty olives. It takes one button. I don't need to do 45 back and forth. So I think that probably makes sense. I'm curious how long has Zoes been running now?
Well, yeah, technically 25 years. So I'm, just 40. So,
Sure.
but I guess in the world that we live at the moment, it's probably about 10 or 12. In terms of.
So you've seen a lot of stuff in dental years.
Yeah.
If you had to make a bet 10 years from now, 2026, 2036, let's say Zoe is still going, if no one's bought it yet, but 2026 going. What do you think will have changed, and what do you think will not have changed in this market from what you've seen change in the last 10 years?
It's a great, okay, there. Where's the crystal ball? As I look into the crystal ball, I see, that's a really, really good question. I haven't challenged myself on that. And I think obviously AI is incredible of what it's doing. So I think more and more things are going to, it's a good thing. And one example is like, what's going to win? Is it going to be this is a broad discussion, but is it going to be the platform that wins, or is it going to be the individual components that are going to win? Example, is it the platform that holds all the digital assets, and that platform is the value, or is it the individual assets on their, so there's what I've seen in the last couple of years is great products like MSK, cancer, and digital products, mental health, ADHD, diabetic, kids' mental health, whatever it is, they're great on their own. But then suddenly, can you get that on a platform as a standalone? And so because there's a lot of integration, there's procurement cycles, etc. So is it the rise of the platforms that are winning rather than the individual? So that's been an interesting thing to see. I think it's going to lean more towards the ease and the one platform, and the platforms will probably acquire the individual. So there's going to be a lot of that sort of M&A in that sort of space. On the clinic side, wow, it's hard to imagine what it would be like, but it's going to be, I think, what we just described as what a clinic should be. Yeah, they're probably the two areas that I would.
Where you see the most, you make the bets.
Yeah.
It's interesting in the clinic version. One of the things you mentioned, you said, happy patients, happy practitioners. And so it sounds like you still think that the practitioners are safe, by which I mean, we're not going to have robo physiotherapists rolling around. Maybe there's augmentation, etc. But you still think that there will be a patient-provider relationship at the heart of the healthcare journey?
Yeah, I really do. I was thinking about this with my wife the other day about our kids. Is how is my son Jacob is 11. What should he be thinking about? What's his job going to be in the future? And that's really hard. It's like, I think it's going to be dramatically different. We had a bit of a debate around the table, and it's like, yeah, what jobs are safe? What are they? But I don't see it that way. I see it as just another step in humanity's cycle where, the Industrial Revolution dramatically changed things, etc. This is a turning point, but things will change. There's no doubt about that. And we need to adapt. So, but I do think there's a thing called the therapeutic alliance, whether that's psychological or physical from an MSK or a mental health point of view. And that is a very personalized, relationship between practitioner and patient. And I can't see how that will change.
Mm-hmm.
Maybe in the future, but I just see that's such a vital thing for good outcomes. You get that matching thing we were talking about earlier about sort of getting the right therapist for you and your condition and all sorts of different matching things from culture, religion, whatever. If you find the right clinician, mental health, MSK, your outcomes should be better. It's just like, dating, you find the right partner, you're going to get married. So, and I don't see how that will change. Yeah.
Yeah. It's interesting. The one of the things that we sort of see, so all of our work is in what we call hands-on healthcare. So these are things that you can't buy over the counter yet, or off Amazon yet, or whatever it might be, right? You can't go in and do, it'd be great if you could, but you can't go in and order laser hair removal to your house. These are big machines. You have to go do it, dentistry as well. You don't get dentistry. So we do a lot of hands-on healthcare. One of the things that we're seeing more and more is providers trying to automate away the admin, as you're describing, and also running into, I'm going to use the word challenges. It's probably a gentle word, like absolute disasters when they push that ball too far, too fast. And I hate to go after any particular kind of player, but one of the places we've seen this a lot is in AI receptionist land or AI, in the patient interface, because there's a lot of variability. There are a lot of weird and wonderful. And if you get it right 80% of the time, that's incredible, massive efficiency, time saving, etc. But if you get it wrong 20% of the time, and that 20% creates 200% new work, taking it from here, putting it over there. What is your view on, I'll describe it as the human and the loop? How much human needs to be brought into the technology deliveries? It sounds like there's a provider-patient relationship, it's very important, but how much of this can we just give over to the robots?
Yeah, and how much reflecting when you said that on the reception side, I would probably still have a receptionist, but that reception is more around a culture builder, welcome to the clinic, because AI is not going to do that, is it? It doesn't have an emotional at this stage. It doesn't welcome you like the lady downstairs that came in. She's lovely, and I always remember people at the front desk who are incredibly friendly. There's a lady I did some work with the Football Association, St. George's Park, and I still remember her. I see it every time I go up there, and she is wonderful, and everybody knows her. Do you know what I mean? She is just, everybody within football knows her, and everyone who goes there knows her. And she having someone like that creates an amazing culture. So I think that might be the role of the receptionist, rather than having to do all the admin tools and
move it here, copy it there,
and just like booking people. Be that patient face and welcoming. Just like you go to a lovely restaurant, they greet you and they look after you. It's it adds to the experience.
So we use it, adopting technology to make it more human.
Yeah. So I think that I've gone back to what Zoes clinic. So I do have a human look.
Fine. Okay.
Let me just change the business way.
Cool. That's really interesting. Well, look, I think there's a lot to dig into here. And I think for folks who are interested in or listening, they can reach out to you.
Yeah,
They should reach out to you.
definitely.
For any and all questions around healthcare, go-to-market,
Growth.
growth.
We do deals. We're doing deals all the time.
Growth. And of course, if they want to come to Zoes clinics,
Yeah,
should also reach out to you about
if you want to challenge me and then tell me what the business plan looks like.
that's a good attitude. And I think, look, we've had the pleasure of working with you guys for a while now. And I think also for us, what's always been hugely helpful is you guys will say what you actually think. And if you think something works well, doesn't work well, nudging it this way, pushing it that way. And I think, that's been hugely refreshing because it's not always the case when you work with people. But equally, I think that honesty in the conversation, it moves things forward.
Yeah.
And that is true even when we're dealing with clinic providers. When we speak with a CEO of a clinic group, and I've got one in mind in particular who, she will not hold her tongue in the best way possible. She'll say, hey, this isn't working. This is where we need to make it change here. And I think similarly, one of the things that maybe a parting idea is for the healthcare providers that either you're working with or that we're trying to sell to and work with, I think it's okay to just give feedback. Just be very honest and just say, hey, this is what, you're not meeting this goal.
Yeah.
You need to be here in order for me to take this to the next stage. Yeah. Absent that feedback, the innovation won't come. It's never going to get there.
I mean, that's such a key. Hearing the market feedback, positive or negative, you need to give it back. And as an owner of a business, you need to hear that, because otherwise you're not going to be able to adapt. And I've got to have that conversation with one of our clients on Friday because the feedback was incredibly challenging. Not and it's important for them to do a certain number of things to continue on that contract. But that feedback I need to have because that's essential. And that's what we set out to do. As I said, it was transparency, which is honesty really, and then kicking goals, having fun. And the other thing is in all of this and AI and tech and people is you've got to still have fun on the journey because otherwise it does create stress. So we made sure that our team, no matter what, because, commercial, you're up and down, you're winning, you're losing, you're in the middle, and you got to be able to pull together and have a community that can help each other and have fun on the journey as well.
Tim Wright, Zoes, founder, CEO, Zoes Clinics, founder, CEO.
What happened?
And having fun on the journey, Tim. Thank you so much. Really appreciate you coming in.
Great.
Wonderful.
Thanks for having us.
The conversation.